about tonight?
Stem cells.
Ah, we might be talking about those. Kind of. Yeah, we're going to talk about your stem cells. So, regenerative medicine. So, how to help you help yourself, right? So, I think, Han, just let us know when there is a decent amount of people and we'll get started. So, everybody's excited to be here tonight?
Yes.
Ready for summer? We've had like such an amazing spring. It's just like, we've been so spoiled. I don't even know what summer is anymore. I feel like I'm in a different place. I feel like I'm in a different part of the world. All right, so we're gonna talk about regenerative medicine. And I've got all kinds of fun props up here to play with. So first, I want to give a shout out to somebody special. Today is my little boy's birthday.
Wow.
He's 27 years old today.
No way.
So I know some of you have known my kids since they were like little. So 27. I can't believe it. That's
Happy birthday,
strange
Sean.
one. Happy birthday, Sean. We're all gonna say happy birthday. 1, 2, 3.
Happy birthday, Sean.
All right, so now we will talk about regenerative aesthetics. So what we're doing in regenerative aesthetics is we're kind of waking your cells up and waking your body up. And I kind of like this picture because it's somebody that's a little sleepy and dreamy. And that's what happens to our cells when we age. They get a little sleepy. We're not building as much collagen and elastin, and we lose that elasticity, we lose that volume, we lose bone structure. All those things kind of start going down, and it actually starts when? Does anybody know when that starts? What age?
30.
Who said 30? Yep, 30 is correct. So around age 30, of course it's going to be different in different people, but around age 30 is when our collagen, elastin starts taking a dive. So that's why I know a lot of my patients are like, wow, these 20-year-olds, these 30-year-olds are getting Botox, they're, getting stuff done, they're getting filler. Well, they don't have it wrong, because really about 30 is when we should do it. Now, a lot of us, when we were 30, none of this stuff existed. So, we're all excused for that. But nowadays, I think it is a good idea to get the baby Botox to stop the lines from coming, to do things that are stimulating your collagen from even age 30, so that we're able to keep things going. So one of the messages you're going to hear over and over tonight is that we're going to be doing something that injures, and then there's healing, and we're going to do things to help stimulate that healing more, so that you're going to really help yourself build that collagen, boost that collagen, induce that collagen. We want to get that back. Now, volume is a different story, so we're not going to talk much about volume tonight, because, we'll talk a little bit about volume with one of the products. But volume is something that is a little harder to help induce, but we will talk about that as well tonight. So everything, I think probably 90% of everything I do in my practice is regenerative medicine or regenerative aesthetics. So I'm not going to talk about everything. Last month we spoke about all therapy, and we spoke about radio frequency, and we talked about some of these the laser. So I'm not going to talk about them tonight, but if you have questions, let me know. But those are all regenerative aesthetics as well. So that everything that we do that's causing injury, that's causing healing, is really regenerative aesthetics. So I wanted to focus on 4 things tonight. And then if you have questions about other things, you let me know, okay? So basically, we're just asking your body biologically to kind of heal itself and replace your collagen. And that's not a lot to ask. And I have patients who are 80, 90, and they say, can that still happen for me? Honestly, yes, it can. And I see it all day long, and some of you are raising your hands in the audience. Yes, I think I had a lady today who was 87, and she said, but I'm 87. I said, and so? I mean, I had a 90-year-old, I used to always do her lips, you know, she loved them. She didn't let anybody know, her grandkids. So the 4 things that I wanna focus on tonight are, number 1 is exosomes. And we're gonna talk about what exosomes are. In a nutshell, they are coming from a 24-year-old source, and they're going to stimulate your stem cells. We're gonna also talk about microneedling, and microneedling is basically this pen here and this, and we'll talk about this more. How can this induce collagen? Oops, oh gosh, I don't wanna drop that. We're gonna talk about sculptra and Radiesse wash. Now most of you have heard me talk about sculptra and Radiesse. We're gonna talk about it in something called a wash, and we'll discuss more what that is. Also, we'll be stimulating your collagen and elastin. And then the last one we're gonna talk about is our plasma pen. And that's up over here, the Subnovi plasma pen. And it is plasma energy that is also going to be helping induce collagen. So these are the 4 things that I'd like to focus on today. And like I said, if you have questions about other things, I'm more than happy. And please ask questions as I'm going along. And I will try not to bore you, because I know somebody was already yawning on their way in here. All right, so first we're gonna talk about exosomes. How many people in the room know anything about exosomes? Raise your hands. Hey, there's gotta be more people in here that know exosomes. No? Okay. All right, how many people in the room know something about platelet-rich plasma? Okay, so I see a lot more yeses to that. Okay, so I'm gonna start with that because I really hardly ever do that anymore, and I'm gonna tell you why. Platelet-rich plasma is basically drawing your blood, spinning it down, getting rid of the red blood cells, taking your plasma, which has platelets in, and if you're using a good machine, you're going to spin again to make sure you get a really concentrated plasma with platelets in. And why would we want your platelets? I always call your platelets the first ones to the scene of the crime. It's like the ambulance that comes, and they're going to go there. It's something called a platelet plug, and what they do is they send messengers out and they bring in all your growth factors and everything that you need to help heal that wound or injury. So anytime you like hit yourself, cut yourself, you know, any of those things happen, the platelets are the first ones there. So that's why you want that platelet-rich plasma. So when we take that and inject it or put it on you, it's bringing in, you know, even though you haven't really had an injury, it's bringing everything there to heal, to build your collagen, elastin, and give you a more youthful, vibrant appearance. So why wouldn't I use that? Think about your platelets and your plasma. I always say your plasma is only as good as your plasma. So your plasma is great when you are probably 20, 10, 9, 8. When you're over 30, it gets to be less great. So, you know, I was always hesitant when I was doing PRP to do that in my 70-year-olds or anybody actually over 60, because I felt like it's a lot of money and I don't know what they're getting from it. They get something, but it's not as great. So enter exosomes. So exosomes are actually, they come from a 24-year-old source, and they basically come from the adipose tissue, and that's where we have a lot of stem cells. But it's not actually the stem cells. We're just getting the messengers, that's almost little vesicles that go to your stem cells, which your stem cells are still vibrant. Like if we could just take all our stem cells out and make them work, they're gonna do a great job. So these messengers go to your stem cells and say, hey, wake up and do your job, something's going on here, we have an injury, we need some healing, we need some collagen, we need some elastin, we need some we need the growth factors here, we need to get things going. So that's what exosomes do. And it's really exciting because now all the things I was using PRP for, that I was, wanting to put on, your face with microneedling, to put on your scalp to help you grow hair, put on after a laser, all these things now, instead of drawing your blood and worrying, is it gonna really do a great job? I can use the exosomes, which come from this young source. They're acellular, so we don't have to worry about transmitting anything, untoward, and we can just use them safely. So that's what they are. They are not FDA approved to be injected, so I am not injecting them. They're being used topically. They're FDA approved for that. I think there are some people that are injecting them, but some things I'll do before they're FDA approved and some things I won't, and that's one I'm just waiting to make sure that that's, no problems with that. So exosomes have a great, for me, it was a really nice addition to the practice for many reasons. It was nice not to have to draw somebody's blood and spin it down. That takes a lot of time. The kits are expensive to use, even though you say, oh, it's on my plasma, why should I be paying a lot of money for it? The kits that they have for us to do it the correct way are expensive. So the exosomes, I think, is a better price point, and it's gonna be much more effective. I don't worry, because it's really gonna work about the same on everybody. Although I will say nothing ever works exactly the same on everybody, but it's gonna give you your best bet. So I have 4 ways that I use exosomes in my practice. And one is to, it's the easiest way, and it's something I came up with. It's called exosome, exosome micro, thank you. So exosome micro is an easy one. It's no pain, no downtime. You're gonna start seeing results with a nice, beautiful glow in your skin within a week. And it takes like 15 minutes to do. So that's like a no-brainer. And I think it's $350. So it's a great price point. It gives you a great result. It's no downtime. It's great for all my patients going on vacation. If you have a big event that you have, I have some patients that come to me and they're getting married, or they're going to be mother of the bride, and it's in a week, and like not a lot I can do. It's great for that. So I love to do it just when I have the time to do it, because within a week, all of a sudden everybody's commenting on my skin and how great it looks. So it's a real easy way to use it. I've also noticed that if we use it right after somebody's had filler and they've had all these injections, that it actually decreases their bruising about 50%. And I'm using that number because some of my patients have said like they had no bruising after that, and they usually bruise all the time. And some have said they have, maybe a third less bruising. So I think about 50% is a good way to say it. So that's the number 1 easy way to do it. Then we have it after our laser. So the Renew Cool laser is the laser we have, CO2 laser, which in the past would have 7 to 10 days of downtime. And with this generation of machine I have, the downtime is that you can put makeup on in 24 hours, and that you can be out and about the day of. You just can't touch it for 24 hours. But what we found is if we put the exosomes on afterwards, sometimes some of my patients that had a laser that were really bright red right after, by the time they walk out of the office, they almost look like they didn't have their laser yet. Now, I'm not gonna say that that's for everybody, but for many. So it significantly reduces your downtime, and it gives you better results. So because it's also you're with the laser, you're causing injury, you're having collagen stimulation, you're having regeneration of tissue, and now you've boosted it with the exosomes. So it's an add-on for our laser as well. And patients have really been loving it, because usually like within an hour, if they feel like they're on fire, within an hour they feel great. So it makes it what has become a really easy laser to use even easier. So the next way we do it is with microneedling. So this is our microneedling, and, well, it's not plugged in. I was gonna put it on. It makes a little sound. It's basically, this is the tip. Everybody gets their own tip, obviously. There's needles on the end of this that are going to go up and down with this, and we can adjust the depth that it's going, and we can adjust how fast it's moving on here. And it's basically, I don't wanna say a no downtime procedure, but minimal downtime. So with this procedure, you're going to get improvement in pores and increase in elasticity, fine lines, wrinkles will be better. And the nice thing about this is that you will have basically be able to next morning wash your face and put makeup on and you're good to go. So it's a nice treatment to get a nice refresh on your face. And the last one would be exosome hair restoration, and that's basically for somebody who has thinning hair or a patch of hair. And in the past we used to do PRP, and we would inject it into the scalp, and it hurt like HE double toothpicks. It was horrible. I mean, it felt like somebody punched you in the head, and then it would go away. It wouldn't last long, but it was pretty awful, and people struggled through that. And that's what got me so excited, actually the most excited about exosomes, because now we can microneedle it in the exosomes, and we're getting actually better results, quicker results, and there's not the discomfort that you had with the PRP. So, and it's because it's from a younger source, and it's a little more consistent. So those are the ways that I'm using the exosomes in my practice. Any questions? Yeah.
You keep referring to a younger source, a 24-year-old source. What is the source?
I don't know the exact person it is, but it's a human source. But it's basically, it's fat tissue from a 24-year-old source. It's made in South Korea, and it's not the cells though. They use the cells to get the exosomes. So the exosomes are just messengers. They're not cells from that tissue. So you're not, and I know people have asked about, is this person has been vaccinated or not vaccinated? They say it's an unvaccinated person, although it shouldn't matter because the exosomes aren't really human tissue. They're just the messengers that come from those cells. Does that make sense?
Like a neurotransmitter?
It's not a neurotransmitter, it's like a vesicle that is going to your stem cell and just giving the message. But it's not cellular. So it doesn't have DNA in it.
It's not living.
Right, it's not live and it doesn't have DNA. And the way this is, it's like a powder in a vial, and we reconstitute it with the fluid that they give us, which is actually the fluid that they give us has hyaluronic acid in it as well, and it reconstitutes it into a liquid. So it's really just a serum that we're putting on the skin. Good questions though. Any other questions?
So what about the hair restoration? How does that exactly work, and
So
when will you see results?
we're actually seeing results like within a month, and it's stimulating the hair to grow, basically.
But it has to have hair in order to.
You need follicles. You need to have hair follicles. If it's, and I usually will look at the scalp. If there's no hair follicles there, I usually don't recommend trying it, although I have done it on some patients that have had scars, and it helped for the hair around the scar, and we maybe got a little bit of follicles in the scar. But if you have a scar and there's no follicles, it's hard to stimulate anything. So it just depends on how the scalp looks. Yes?
How often would you have to have the procedure done? You said you notice it in a month. How often?
Oh, for the hair, We do it in a package of 3, and it's done once a month. And then you can choose to maintain it every 6 months or 12 months to do one treatment.
Have you had anyone with like good results?
Yeah. We've had, my patient has had the best results, won't let me show hers.
Oh.
And I've had patients who've had like what I feel like is a fair amount of hair. This was really popular right after COVID because so many people had hair loss from COVID.
Yeah.
I think from stress, from being sick, a lot of different reasons. So we were doing a lot of it then, and a lot of these patients, some of them didn't even require a whole series. Like what I usually tell people is to do one treatment and then see how you do, just to make sure that you're getting results with it. And then if you're gonna, if you wanna do, you can do the whole package after that. But try one first, because not everybody's gonna be a great responder, I'm not gonna lie, some people respond better than others, and hair is a difficult one. It's a difficult one, but we've had some really great results with patients.
Does it depend on the hairstyle, the hair, bristle, or like if you have fair, your hair is really baby-like?
No,
No,
it
it
doesn't.
doesn't
It
matter.
doesn't matter, no. And it's gonna, if somebody has thin hair, it's gonna thicken. I feel like thin hair is the best. When people, the most difficult is if people have like, they have scar alopecia, where they've had scarring either from like some chemical treatment, or they've had some skin lesion, and that's, I always am honest with patients that may not resolve, but that they'll thicken the hair around it so it's better. And so they, like, sometimes in the periphery you'll get some hair stimulation, so it's worth trying. And a lot of those patients have like diffuse thinning, so they're really doing it for that as well. And we definitely see some nice results. Actually, somebody who had a really good result, my son's girlfriend, and I forgot to put pictures of hair in here, but she was probably one of my first patients I did it on during COVID, and unfortunately I did hers, and I did it like deeper than what we really need to go, so it was painful. But the second time she did it wasn't bad because she had Shannon do it.
Yeah.
So Shannon did it the right way. But she had great results, like that I was noticing at the dinner table watching her. It was just coming back like crazy, her hair, because it had really thinned out. And I don't even know if it was COVID or what.
What is the price of doing that?
Actually, the ladies can tell you the prices afterwards, but it's really, what's just been great about it is after injecting PRP and having people just be miserable so many times, doing this, I'm not gonna tell you it's painless because it's microneedling, but it's so much easier. Yeah, I mean,
painless.
Shannon's the one that does it, so she sees them through it. I don't think we have very many patients complain.
Never.
So, yeah, it's an easy procedure, and then you just leave it on, and we always, with exosomes, we just leave it on for 4 hours, no matter where we put it, and after 4 hours, you can wash your hair and go out and about. I always tell people just bring a cap with you so you can leave. I put a shower cap over it, and then a cap on top of it. All right, so now the second thing I want to talk about is microneedling, which we've kind of talked about already, but let me just look at, I think we've talked about everything. So if you choose not to do, so microneedling by itself we've been doing for a long time. It's been around for a long time. I think what's made it more exciting is the exosomes. So if we don't use exosomes, you can do it with PRP, but like I said, the limitation for PRP, only as good as your PRP. And I still have, like, every once in a while, somebody who just really wants PRP because they want their own stuff. They want to be just very pure, they want to do their own, and we do it. And that's something that is, like, normally before exosomes came out, I would be talking a lot about PRP and the uses of it. But like I said, now I don't, and I'll tell you about, like, when we talk about the Radiesse and Sculptra wash, they work similar to PRP and are not as painful. So basically the microneedling we've talked about, it's causing injury with the needles. They go up and down, we can adjust it. And then when we cause injury, we have healing. So that's the great part about it. And with the exosomes, if we use them, then we're getting more healing. If we use the growth factor serum that I have, it's just growth factors, and it's not gonna give you as many growth factors as your own stem cells would bring in, but it's still good. It's just that I feel like the exosomes are like way above. And Shannon sees this because, you know, when she does the lasers especially, she can see, she does lasers all day long, and she sees the difference between, you know, if you wanna just talk about real quick, the difference between when you've done a laser without exosomes and when you've done it with
Absolutely.
it.
So I just,
Sorry, you have to step this way.
oh, sorry. So, just one example is when we first got them, I was kind of like, like, I don't know if it's gonna work, I don't know, it's something new, I didn't know about it. And I have a patient that comes to me usually once every 6 months or so, and she gets beet red from the laser. Like, I'm talking like super, super red. And I'm like, we're gonna try it on her. And she turned pink like that. And I was like, I'm like, okay. I'm like, this stuff works. And I could sell this to anybody because it literally, like, by the time, she said, by the time you get out and go to the counter to check out, your face is already starting to turn pink. I see white spots, like it's already starting to heal, like that quick. From the time I walk you out to check out, it's that quick. And I don't think I've had any patient that has not healed that quick. I mean, some get redder than others, but it just, you see it healing their skin automatically. And by the next day, they're always like, oh, I'm not red for 2 days. I'm like, okay.
Yeah.
But it's amazing. Same for microneedling. It's
And
amazing.
she's a tough sell. Yeah,
I am a tough sell.
She's a tough sell. She, you know, she really has to see it. She doesn't just believe me.
I'm sorry.
So, yeah, it really, you know, she sees the difference all day long with it. So this is, for microneedling, this is somebody with acne scarring, and he's had amazing results with it. So what can you use the microneedling for? Obviously scarring, for fine lines, wrinkles, pores, just to get like a nice rejuvenation of your skin and just to kind of get a glow. You know, after 30, and if everybody like thinks back to 30s, in your 30s, or if you're in your 30s, that's about when I started saying, oh, my skin just is dull. It doesn't have that glow anymore. And so that's one of the things when you're younger that you would get from it. And then you know, when we're older, we get that glow back. We get that collagen induction and we get our glow back. So this is a nice that. Any questions about microneedling? Nope. Okay. So, Radiesse and Sculptra wash. Anybody heard of that? Nobody. Wow, that's great. You're all getting all kinds of new info. You'll probably be all confused at the end. But so Radiesse and Sculptra wash are neat. Radiesse is basically my favorite filler in the world. And why is Radiesse my favorite filler in the world? Does anybody know that?
It works.
It works. What does Radiesse do that no other filler does?
Collagen.
Yay!
What?
See, I've been a good teacher. It builds collagen. So Radiesse, there's a lot of fillers out there. Thank God we're not in Europe. There's so many more out there. But Radiesse is the only filler that gives you an instant gratification and it builds collagen. So all the other hyaluronic acid fillers, which every other filler is hyaluronic acid, they will not build collagen. They'll give you volume, they'll give you an immediate result, but they're not gonna be building collagen. Now they're trying to say, yes, they are building collagen, just basically because the needle poke, because it's like microneedling, right? If you make an injury with a needle, you're gonna build some collagen, but it's nothing near what the Radiesse does. So Radiesse is calcium hydroxyapatite. It's been around for, I think, about 18 years or something. I started using it before it was ever FDA approved, and just have been in love with it just because of that collagen stimulation and also the integration of the product. When it's injected, it might feel lumpy or bumpy, but within 48 hours, it settles into your tissue and it feels like you, looks like you. I have a little bit of it in my face, and sometimes I'll let patients just feel it. You can't feel that it's there. You don't see that it's there, you can't feel that it's there. I can see it's there because it's lifted me up nicely. And the collagen stimulation I've actually gotten, it's just been a couple months that I actually put filler in my face for the first time. The collagen stimulation, I noticed after like 3 weeks of having this product, I noticed that it is inducing collagen. I feel more, and it gives like a little bit of a glow, so that's nice. So when we're talking about a wash, we're actually blending this with saline and a little lidocaine, and then at different dilutions depending on where in the body, so it makes it more liquidy, and we can put it a little more superficial in the skin. So when we do this procedure, we can do it with a cannula. This is a cannula which will look to you exactly like a needle, and a lot of people ask me, what's a cannula? So it looks like a needle, it's about the same size as a needle, and they come in different sizes and different lengths, but if I go like this, it's not going to penetrate my skin. So when I use this, I'm gonna make a little poke somewhere. So if, say I'm doing this on the face, I'm gonna make a little poke right about here, and then I go in with this, and I can take this cannula and go like this. I don't know if you can all see that. And just from that one poke, I can distribute this now blended product all over your face. So now you've got this thin layer of product all through here. And what happens here that we all hate? Little lines when you smile, right? We call these the waterfall lines. So we can get in there and put a little bit of collagen stimulation with the Radiesse in there in a very thin way. So it's not really necessarily going to give you a bigger face or more volume, but it's going to stimulate your collagen and give you smoothing and help induce collagen from the inside out. So it's really, it's exciting. I always say it's never one way to skin a cat or one way to attack something. There's always, it's always like a whole, it's a whole progress, a whole combination of things. And the best therapy is combination therapy. So we're not a place that just does lips and Botox, you know, or jawline or chin. We're a place that you're gonna come in and we're gonna look at your whole face, and we're gonna say, this is the program for your whole face. And then you can kind of attack things the way you want to. You know, everybody has a budget, everybody has a different way of looking at things, everybody has different priorities. So we work with you to plan how we're going to do things. And that's why every one of my patients, if they've been with me and they've been doing the things that I'm asking them to do, and I always do this, I take your first picture when you walked in my door, you always are gonna look younger than that first picture, unanimously. I don't have any patients that I can't say that about. So with this Radiesse wash, and I'll talk a little bit about the Sculptra, it's done the same way. We're just putting this thin layer in there, and it's going to help smooth. And I use it sometimes when I do Radiesse on the cheek. Sometimes there'll be like a little drop off from here to here. So sometimes I'll use it to kind of marry, I'll say I'm gonna marry your cheekbone into your jawbone a little bit. So we can use it that way as well. But a true Radiesse wash is where we're just putting it in to stimulate collagen from the inside out. Yes?
Can you use a Radiesse wash for crepey skin on the arms?
Yes, so yes, you can use a Radiesse wash for anywhere on your body. So we do a lot of necks, because necks is another thing where it's not just one thing. It's usually, you know, we're gonna tighten you with a laser from the outside, lift you from inside with all therapy, and then this is gonna actually give you collagen stimulation, smoothing, tightening, and you can do that on the neck. We can do it on the décolleté, we do it on the knees, we can do it on the arms. And it definitely works. The nice thing about Radiesse is that it's gonna give you your instant gratification. So, and that's that kind of sets it apart, because I know I'm gonna talk about sculptra, and you're gonna say, how will you choose one versus the other? So sculptra is this little vial here. And this little vial here is a liquid, and the particles, which if you wanna come up and look at it later, you can, it's tiny little particles. And it's PLLA, which is little, it's what resorbable sutures are made from. And they're basically ground up into a fine powder in here, and before we inject it, we reconstitute it with a liquid. So sterile water and lidocaine. And then inject it into the face. And what happens is, within 48 hours, everything I did is gone, and then the little particles are in there, and they're like little seeds, and they're going to stimulate your collagen. So it takes 6 to 12 weeks to see your full results with this. But it's great because it lasts, those results, because it's your own collagen, those results are gonna last for 2 to 3 years. So the longevity is higher with this. So you get the immediate results with the Radiesse, and the results last usually about a year. The sculptra, you get the delayed results, but they last 2 to 3 years. And there's a couple reasons why people wouldn't be able to use sculptra: if they had autoimmune disease, if they've ever had keloids, if they smoke, or if they've ever had a reaction to stitches before. So most
Like
people,
latex?
latex is okay. It's not an issue. So sculptra, same thing. I'm going to dilute it more so it's thinner, and then I'm gonna use the cannula to go in there and spread it out, either in the neck or in your chest or on your knees, which is a great place to do. And over time, it's gonna tighten and smooth that tissue. So these are really, you know, I like to talk about these because it's something sometimes we forget to talk about. And it's one of the other things, you know, when somebody comes in and they say, well, what can I do about my chest? Yes, we can do laser to help with the sun damage and tighten from the outside and smooth. But then it's nice if somebody's got a lot, you know, of crepiness here, we can go from the inside and stimulate that as well. And then it's like, I always say 2 + 2 is like 8 when you combine these things instead of 4. Yes?
How do you choose between the Radiesse and the sculptra? I mean, you
So,
the person.
yeah, I usually do, I kind of like, it's case by case. So if somebody wants something more immediate, they have an event coming up, then we'll do the Radiesse. If somebody's more patient, then we'll do the sculptra. If somebody's already been doing sculptra on their face yearly, well, then it's an easy decision, right? We just go for the sculptra because we know it works on them. And sculptra is, you know, not everybody's gonna be great at boosting their collagen with sculptra. Excuse me. Is one of those things that, and it's not, it is somewhat age related, but in my experience, I haven't found that to be the case. Some of my worst patients at building collagen were like, I call it young, and they're like 50s. And some of my 70, 80-year-olds do a great job with building collagen. So it's really more, I think it has to do with your genetics. So you know, if we know collagen's working in you, then I think collagen's, if we know that sculptra is working in you, then sculptra is the choice. And if we're not sure, then maybe we would decide to use Radiesse, because we know for sure that we're gonna see something with that one, because it's got that immediate
So if I hear you correctly, I could still have the Radiesse, which I've had for years, but the wash is something new.
It's something different. It's not necessarily new, which is why I wanted to talk about it. I've been doing these kind of washes before I even called them washes. I've been playing around with Radiesse, and you probably had a little bit of a Radiesse wash on your face without me telling you that.
Got it.
Because I've played around with it and I'll dilute it. If I have a space where I don't really want necessarily a lot of volume, I just want more smoothing, you've got like some of those, you know, these waterfall lines, or you're talking about crepey lines, I'm already kind of building that into your treatment, but not telling you, oh, well, we did Radiesse like this, and then we did a little Radiesse wash on you. So a Radiesse wash technically in my practice is where we're just doing the hyperdilute, and we're going in there to smooth everything out. And it's, you know, it's a nice treatment to do, you know, if you want that little immediate smoothing and everything to kind of marry in and stimulate that collagen from the inside out. Any other questions? These are all great questions, by the way. Anything else? No? Okay. So, we've got, by the way, I forgot my prop here. This is our exosome vial, that little powerful thing we have. All right, so now, I'm gonna show you some results. So this Radiesse wash, tightening in the neck. She had a lot of crepiness. And this is another one. Now these necklace lines are a difficult problem, and actually they're best with using the laser to try to smooth them, and then we can actually also put filler in there to treat those necklace lines. And even some young people are getting necklace lines these days because of looking down at their phones. Everybody's on their phone like this, and so we have 30-year-olds that 20-year-olds who are getting necklace lines. So they need to treat those because I don't know what they'll be like later.
So if you put filler in the neck lines?
Yeah,
How long does that last for?
usually about a year. Yeah, like 9 to 12 months.
Sounds better.
Is that a misspell on the upper and lower? Should be lower?
Yes, thank you.
It's the author in me.
You know what's so funny is I make these PowerPoints on my phone, so it's amazing that there's not more of these.
What's a lover lid?
It's a lover lid. You don't know what a lover lid is? All right, so does anybody in here know about the plasma pen? Okay, so anybody, I'm gonna just tell you, like, first off, anybody in here who has darker skin is not a candidate for this. So it's one of those procedures, it's only good for skin type 1 through 3, which is like, I'm a 3, somebody can have like a little bit of Mediterranean in them, but anything more than that would not be a candidate, just so I don't want somebody thinking, okay, this is my thing. But, so this is the plasma pen, and I'm gonna just grab it out. It's using plasma energy, so it delivers, let's see, it's this tiny little pen, and I wanted to show you the little treatment because it's a tiny little tip, which you probably can't even see it, tiny little wire. So it's delivering plasma energy in tiny little spots, and it causes a little injury here. And what it's doing, and you actually can see it doing it as the treatment is done, it's tightening the tissue. So you see that the tissue goes zip, 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 zip with each little dot. It's great because it actually can give you significant tightening, even more, a little bit more than the cool laser can do. And we can get a little closer to the lashes, to the, we can treat a little more of the eyelid. Usually with the laser we can get pretty close, usually like within 1/2 centimeter, but with the plasma pen we can get even closer. So it's really great for this thin skin that we have on our eyelids. That skin is actually so thin, and I tell people this all the time, that, and I've seen this, you can actually read newspaper through that skin. And I've seen that on a cadaver. You put it up and you can see print through it. So it's very thin skin, and that's why you always have to be careful. That's why sometimes fillers are not a great answer for under the eyes, because people can get bulging. You can see the blue hue of the filler sometimes. So with this treatment, it's a really nice way to get some significant tightening. There is some downtime with it. You have little brown dots. They look actually pretty cool. It looks like that you have had like a, what's that called? Henna tattoo, thank you. So it looks like a little henna tattoo almost, and I'm gonna show you a picture of it in a minute. But those little brown dots actually are little scabs, and they will fall off within 5 to 7 days. So you can't put makeup on them during that time. You just have to put on a little light cream, and there's a powder, volcanic ash, because you want to keep it dry. and that's all you can put on. So sometimes the volcanic ash covers it a little bit, but I mean, it's definitely gonna be there. It's not like big, bold, bright, and you're gonna see on the picture, it's, even from where you're sitting, you won't see the dots as much. But, it does a great job, and I'm gonna show you some before and afters. So that's one, so tightening under her eyes. And she had upper, lower lids done. So, and that's mine, I just did my lower lids. You see those from there? That's another one. So that, actually, this picture was just a month after that first picture, and this other picture is, I think it was 6 months after. So collagen stimulation, and that's what the dots look like. Just so,
Do you go on top of the eyelid?
I didn't, you can, yes, so you can do the upper and lower lids.
But like right here?
Mm-hmm, yeah. Yeah, you can go right there on the lid. So basically, we do like the little dots in rows. So it's just boom, 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 boom.
Does that lift the lid?
It tightens it. Are you talking about lifting the brow or
No,
lifting the
the
lid?
lid.
Yeah, yeah, it will lift your lid. Well, it just depends. Now, if you have like a very lazy muscle and that's why your eyes don't open, it probably won't, but if it's just that your skin is very loose and lax, it will tighten up that skin and it will feel more open on your eyes. Anytime you do anything for that skin to tighten it up, even if I do like a little brow lift here, which tightens that skin a little bit, it will feel, your eyes will feel more open, like you can see more around you. All right. Any questions about the plasma pen? Okay, everybody get some new information tonight? Yeah,
How much does the plasma pen cost?
so we have all the prices, either Gisa or Shannon can give you all the prices. So if you prepay tonight, it's 15% off, like always. And basically it's off any of the exosome treatments that we use the exosomes for. The microneedling, which don't walk out just yet. Microneedling, the Radiesse, or sculptra wash, and the plasma pen. So that's our special for tonight. And I just wanted to introduce everybody to Jennifer really quickly. This is what, day 3? Day 5? 4? 5. Yeah. So Jennifer just started as our new front office. I don't know if all of you know, but Annie left several months ago, so we just have been waiting for Jennifer to come. I've known Jennifer for a long time. She actually started the whole spa and what is it called, at Harbor Ridge.
Yes,
But
the
it-
spa we
Yeah.
brought Dr. B into all our members where she would come in and do Botox for our members, and so.
So Jennifer is amazing, and she's our front office and our
Yes.
community. Yeah.
Yes.
Yeah, so she's front office and community liaison person in Tequesta. She lives right here. She can walk to work, so it's amazing. So now we have a local homegrown person here. So I think you will enjoy her. And we do have, I wanna say happy Mother's Day to everybody. And we have roses for you on your way out that are gorgeous. So enjoy those. And then I did, the secret code for all of you that hopefully are still there is collagen. So if you call within, by tomorrow and give the secret code, you'll get 15% off as well. So I have a question for everybody, for our next one or for next year. So we'll take a little, well, we may do one this summer, but probably take a break. For next year, does anybody have anything they particularly want to hear about? Any ideas? Okay, well, I'll just keep coming up with what I'm coming up with. I think, I try to keep talking about new things, and regenerative, I keep saying medicine, but regenerative aesthetics is really, I think it's like the new buzzword, which is why I wanted to talk about it. But when I think about it, it's really what we've been doing for years and years and years, but now they're just calling it that. And there are some new things like the exosomes. And I think there's gonna be even more things that are new out there in the upcoming year. So I'm actually going to a conference in Stockholm at the end of this month, which I love going to European conferences because I feel like in a lot of ways, and especially in regenerative aesthetics, they're a little more ahead. So they have some different ideas. So thank you all. Yeah.
That's very
I mean,
good.
I know the face and neck are like telltale signs of aging, but so are these.
Yes.
Do you do anything for this?
Yes, yes, and I had this out there because I wanted to talk about it. So that it's not technically a wash, but it is, but we have a hand treatment with Radiesse. Sculptra would never put in the hands because Sculptra can get a little lumpy bumpy sometimes, but Radiesse is great in the hands. So if you need volume, so if you need to cover like veins or tendons, you feel like it's just your hands are looking like they need volume, Radiesse is great, plus it's gonna give you better looking skin. The laser, if you have a lot of sun damage, brown spots, the laser is great for that. So yes, you're right, hands are telltale. So I put this out there for a reason, and thank you for the question because I forgot to talk about it. And it's really nice and easy. I blend the product so it's nice and thin. I used to do the Radiesse like straight up in the hands, and it would be very lumpy, bumpy, and it would take a little while to settle down. I have to have people sit on their hands while, you know, to settle. But now that I blend it, it just goes in so much smoother. So you're like right out the door, it's looking nice. And so we do have a treatment for the hands, and you can ask them about that. Any other great questions? Anything else I forgot to talk about? All right, well, thank you guys for coming. Eat more food, drink more wine, and enjoy your flowers. And I'm up here to do consultations if anybody needs a consultation, or maybe I'll go out there. We can do a consultation if you're confused about what you might want to do, or if it's a good thing for you.